Welcome to the Heart Hospital of Austin. I'm Greg Underwood. I've been in your shoes. I understand how you may be feeling. I was a heart patient 3 years ago. You're in a very good hospital that specializes in cardiac care and has received major national awards for excellence, including #1 in Texas and one of the top in the United States. One reason is because of the nationally renowned physicians and their great patient care teams. They truly put their hearts into caring for yours. From the CEO down to the time that you're discharged, you've made the right choice.
Hello and welcome. I'm David Laird, CEO of Heart Hospital of Austin. Our goal is to provide you the finest care and service in the world. We do this by providing a safe environment for your care, being very responsive to your needs, and doing it all in a caring and compassionate manner. You'll be treated by some of the finest caregivers in the nation. If there's anything that we can do to make your stay with us better, please let me or any one of our team members know. Your care and recovery is our highest priority. Thank you for choosing Heart Hospital of Austin.
I'm Blake Darnell, Director of the Cardiovascular Intensive Care Unit. We are all a team, and we're your team. It's each one of our responsibilities to make sure you have the care you deserve. Before each day, we all round up as a group, talk about each patient, and associate our eye care values with the daily activities. That stands for integrity, compassion, accountability, respect, and excellence. Ask any member of our staff if you have any questions at any time. If they can't find the answer, they will quickly find someone who can.
During your stay here at the Heart Hospital, many different team members will be coming into your room. We've developed an easy color-coded system to help you identify these team members when they are in your room. Our nurses will be wearing a navy blue scrub top. Our hospitalists will have a white lab coat. Our pharmacy, respiratory therapy, and imaging department will have an olive green scrub top. Our patient care technician will have a beige top. Our environmental services department will have a button-down olive green top. And our volunteer will have a navy blue sport coat with a Heart Hospital emblem on the chest. Your nurses are on the front lines of your healthcare team.
My name is Judy Brindley and I'm a nurse here at Heart Hospital and I work in the Cardiovascular Intensive Care Unit. In the CVICU, we work to stabilize critical cardiac patients and patients after heart surgery. We coordinate your care between the respiratory therapists, the nurses, the patient care techs, and your doctor to make sure that your lab tests and your care is carried out quickly and efficiently. Managing your pain is a high priority for us here at Heart Hospital. Your doctors and nurses want to know when you're experiencing pain so we can do what we can to alleviate that pain for you. Please feel free to use your call light and call us so that we can communicate with you and make sure that we are giving you the proper medication and repositioning and any other things that we can do to help you. The food here at Heart Hospital is excellent. We have a lot of variety to choose from for your meals. You're able to order a meal almost any time during the day. Family members are allowed 1 guest tray per day at no charge. We have an open policy with no hour restrictions, meaning you're able to visit the patient at any time. We do ask that no more than 2 visitors at a time when you're in CVICU. No children under the age of 12 due to infection risk. Your family is an important part of your care team, and their support will help you to recover more quickly. There is a place for 1 person to sleep beside you, even in the CVICU.
The Heart Hospital has physicians on staff known as hospitalists. They will be directing your care team and making sure that your care plan is followed.
Hi, I'm Dr. Shah. I'm the hospitalist here, and I'll be the quarterback for your team. A hospitalist is a board-certified internal medicine physician who works predominantly in the hospital setting. As a hospitalist, we are able to streamline your health care. We are able to coordinate care with your other physicians, along with the nursing staff and other ancillary staff to help improve your care, and usually provide a timelier service than your primary care physician would be able to, mainly because they are working in a clinic setting as well. We get to spend all of our time at the hospital. Therefore, we're able to obtain tests faster. We're able to get you out of the hospital faster. I work very closely with the cardiologists on a daily basis. We have some of the top doctors and some of the top nurses that I've ever worked with. Not only are we friends at work, but we're also friends outside of work.
Medication is an important part of your recovery plan.
Our pharmacists take great care to make sure you receive the proper medications at the proper doses when and where you need it.
Hi, I'm Mike Matthews, the Director of Pharmacy.
Many patients ask, why can't I take the medications I brought in from home? We don't know how these medications were stored. When medications come from home, we don't know if they were left in the car or if they have been stored in a bathroom or something like that where there's high humidity that can degrade medications.
When you get a new medication ordered by your physician, it's reviewed by the pharmacist on staff here. They're checking for duplications of medication, correct dose, interactions, any contraindications, and any problems with the disease state. The medications at the Heart Hospital of Austin are located in automatic dispensing cabinets. These dispensing cabinets are in every department in the hospital, and they're just steps away from every patient room. Prior to getting that medication, after review by the pharmacist, the nurse will scan the medication, scan the patient, and make sure you're aware of all the side effects or any possible side effects of that medication. After you leave, it's important that you notify your physician if you think you're having any of these side effects. Certainly call if you have any questions to the pharmacy, and we are here 24 hours a day.
Because we are a small, specialized hospital, our CEO is very involved in the care of each and every patient. Don't be surprised if he stops by your room to chat or just check on your well-being.
As CEO of Heart Hospital of Austin, I often visit patients in their rooms to see how we're doing. If you have any questions or concerns about your care, please notify one of our team members immediately. We will do everything we can to resolve the concern and make sure that you're satisfied. Our goal is to provide exceptional care in everything that we do.
Many families find it comforting to talk to a chaplain during their hospital stay. We have a great team of dedicated chaplains available whenever you need them.
Hi, my name is Remington Johnson. I'm the chaplain coordinator here at the Heart Hospital of Austin. It's my job to help provide for the spiritual and the emotional needs of those who are here in the hospital and those whom love you. We have chaplains available 24 hours a day, 7 days a week for you and those whom you love. You may contact a chaplain here at the hospital through your caring provider or by calling us at the office at 407-7538.
Keeping your room clean is an important part of maintaining a healthy environment during your hospital stay. This is the job of our environmental services or housekeeping team members.
Hi, my name is Karen Langston and I'm the Director of Environmental Services. Cleanliness is an important part of a healthy and safe hospital environment. Each day, a housekeeper will be coming into your room and conducting a daily clean routine. That includes using a germicidal disinfectant to wipe down the surfaces on the countertops and your bathroom. If you need your room cleaned immediately, please tell any hospital staff. The housekeepers carry a digital phone so that we can communicate with all departments in case your room needs immediate attention.
Our cardiac rehab nurses will help you transition back to your day-to-day life. They will provide tips and instructions to make your recovery here as short as possible.
My name's Becky Rogers and I'm a cardiac rehab nurse at the Heart Hospital of Austin. I'm going to help you understand the procedures that you've had at the Heart Hospital so that you understand what happened while you're here with us. My goal is to make sure that you have the tools you need to be successful in your long-term recovery. With the cardiac patients, I help them with walking and will set them up with a cardiac rehab facility near their home. You'll be given a pamphlet or a book that we'll go over and it'll give you your instructions on what to expect when you get home. It's important to follow the discharge instructions you're given in order to reduce your chance of having to come back into the hospital, reduce your need for cardiac medications, and to alter your lifestyle. Should you have questions regarding your discharge, we have case managers that are available 7 days a week to assist you. Your long-term success is up to you. We'll give you the tools you need to achieve it.
Many former heart patients are eager to give back and help other patients during their hospital stay. Most of our volunteers have been in your shoes.
Hello, my name is Greg Underwood. I met you earlier as a heart patient. I'm talking to you now as a hospital volunteer. A volunteer has many roles at the hospital. We're information sources, we're messengers, and we're also just friends. Someone that the family or the friends need to talk to, we're there for them. Some of our patients travel in from out of town or even from out of the country. Volunteers keep updated information on local lodging and hotels, dining options both in the hospital and out of the hospital, and where they can get their prescriptions filled at local pharmacies. We also have this resource guide that each patient is given when they register.
Please remember our easy color-coded system on how to identify each of our staff members. Our nurses will be wearing a navy blue uniform. Our hospitalists will be wearing a white lab coat. The members of our pharmacy, respiratory, and imaging departments will all have olive green tops. Our patient care technicians will have a beige top. The members of our environmental services department, or housekeepers, will be wearing a green button-up top. Our volunteers will have a navy blue sport coat with the Heart Hospital emblem on the chest. Our emergency department is open 24 hours a day, 7 days a week to take care of all your emergency needs, not just heart.
Our commitment to excellence has earned us top recognition in Texas and nationwide. We've been ranked the #1 overall cardiac program for 6 years in a row. We've been ranked in the top 5% in the nation for overall cardiac services. And we've been named a top 50 cardiovascular hospitals by Thomson Reuters. Heart Hospital of Austin was one of only 10 hospitals in the nation to receive this designation. Rest assured that you're being cared for by the finest cardiac team in Texas.